We're joined here today by Dr. Mohammad Masood, consultant gynecologist and director of MAS Gynaecology, to discuss labiaplasty.
Thank you very much. The very reason I chose to speak about labiaplasty is that it is very, very controversial procedure. Many gynecologists are worried about it, and many women are suffering because they cannot get enough help. Finally, the labiaplasty is a procedure used commonly to reduce the size of inner labia, which are the inner lips of the vulva, to reduce the size of it when it causes physical discomfort or sometimes enormous psychological problems.
In your view, who should consider a labiaplasty procedure?
Labiaplasty is for the women who are affected by this condition adversely and feel that their labias are too elongated or abnormal and want them to be treated to make them not to cause discomfort and also improve the appearance.
How are labiaplasty procedures carried out?
This is a surgical procedure commonly performed under local anesthesia or could be done under general anesthetic or sometimes sedation along with local anesthesia. The procedure is done in an operation theater where there are commonly used methods called wedge resection or trim method, and they are designed to improve the appearance and reduce the size of the labia. Now, what method to be used? It depends upon the experience of the surgeon and also the wishes of the woman. I am trained to do both methods, and I usually decide based on the woman's wishes and also assess the patient which method will give the best results and use it for that particular patient.
What is the timeline for recovery after a labiaplasty surgery?
Full recovery takes about 6 to 8 weeks when you can resume all the activities. However, after the procedure, after a few days, you can do normal routine walking and things, but you are advised not to do, for example, lifting weights, running, and doing heavy activity because it can affect the sutures. It is very painful for a few days when you have to take regular painkillers, and if everything is smooth, after approximately 2 weeks you are almost up and about. But as I mentioned earlier, full recovery to see the final results takes up to 6 to 8 weeks.
What should patients do if they think they require a labiaplasty procedure?
This procedure can be done on NHS, but increasingly NHS is not funding this procedure, and most of the women end up going privately. If you are considering, I would suggest that you should search the surgeon and the hospital where you're going to have it done, that they've got proper qualifications and proper reputation and systems in place. So mostly these days these procedures are done privately.
What other information do you think patients need to know?
Now, this is very important that there is a law in the UK which says that no surgery should be performed on women's genital organs without a medical indication. We have got a law called FGM law where it is prohibited and a criminal offense. That's why it is very important that if you are considering or if you're affected by this condition, you must discuss with your GP and get the help from him, and also speak to an experienced surgeon so that the medical indication is properly assessed.
How long have you been performing labiaplasties and where can patients find you?
I have been performing labiaplasties for a number of years on NHS, and it has become increasingly a problem when NHS didn't fund it. So therefore, I resorted to perform these procedures in London and also in Essex in various private hospitals. I started doing them privately for the last 5 years, and I have done lots of them, over 100 procedures in the last few years with the very good results.